I was born with a heart condition called Tetralogy of Fallot.
Tetralogy of Fallot. It's when a baby's heart doesn't form correctly during pregnancy, leading to 4 different heart defects all at once. But Elena Wade's doctors then detected a 5th problem with her heart. We'll show you the science that makes it possible for this sonographer and mom to live a full and active life. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Elena Wade was born with something called Tetralogy of Fallot. Less than 2,000 babies are born with it in the United States every year. It's a heart condition with these 4 main heart defects. And a diagnosis like this is understandably overwhelming for any new parent. But Elena's family had another shock when doctors detected a 5th problem with her heart.
Come on in.
If there's one thing Elena Wade is familiar with, it's hospitals.
You ready?
A sonographer at the University of Kansas Health System.
I do regular echoes and I do congenital.
Elena chose this career because so much of her childhood was also spent in hospitals.
I had to have a feeding tube placed, and that stayed until my heart surgery.
For her parents,
my parents are farmers, and so they hadn't really been in the medical field at all.
It was a crash course in navigating the healthcare system with a newborn. At just 6 hours old, she had her first surgery to try to fix her cleft sternum. Her breastbone never fused in the womb.
There was actually a hole in my chest, and there was one membrane over it, and every time I cried, it swelled up like a bullfrog.
Her first open heart surgery was at 15 months old.
I had a hole between 2 parts of the heart where blood was mixing.
If it sounds complicated, that's because it is. And those 4 defects together make up a congenital heart condition called Tetralogy of Fallot, tetra meaning 4. But Elena's problems were even more complicated.
And I actually had a 5th thing wrong, and that was a hole between the upper chambers of the heart. So technically I had pentalogy of Fallot.
And if a cleft sternum and pentalogy of Fallot wasn't enough for this tiny baby to endure, Elena would need plastic surgery at 21 months old to tackle yet another anomaly.
I have a web, which is an extra membrane of skin around my neck and chin, and so I've had surgery to try to create a chin and get rid of that.
Through it all, Elena says her mom and dad were determined to make sure Elena knew she could do anything she wanted in life, and she did. School, career, marriage. Yet all along the way, doctor after doctor told her that she could never have kids. That's until she and her husband moved to Kansas City, and she became a patient at the University of Kansas Health System's Adult Congenital Heart Disease Clinic. And this is where Elena got stunning news.
And they said, yeah, we think that you can have children, which was, oh my gosh, so amazing. It was such a beautiful blessing to be able to hear that.
2 perfectly healthy children later, Elena has an even deeper understanding, perspective, and gratitude for her mom and dad. Now she combines her personal experiences and her professional expertise to give her patients yet another tool to overcome obstacles, a model of hope and what can be.
I share a lot. It's really nice to have the connection and to say, you know, oh, I've been there and I understand.
Elena is here in the studio with us today. Elena, thank you for being here.
Thank you for having me.
Alongside Dr. J.D. Surface. Dr. Surface is the director of the Adult Congenital Heart Disease Clinic here at the health system. And Elena, you're a sonographer here, you're a patient here. It is so great to have you in the studio. The best part about this morning was listening to Elena and Dr. Surface brainstorm about different heart things on the set when it came to dealing with other patients. You're such a pro in understanding everything that's happened to you. What's it like to have a patient next to you who also has this kind of expertise?
I mean, it's incredible. I mean, I think, you know, Elena really knows her stuff. You know, congenital heart disease is a a unique subset of patients in the adult cardiology world, and it takes some unique expertise like Elena's to actually do the echoes where we get ultrasounds of these patients' hearts. And just before yesterday I was in clinic and Elena was scanning my patients with echoes beforehand, and we were just trying to figure out, there was something we saw, we couldn't quite figure out what it was, and so we've gotten some additional studies, but it's great to have someone, I think, for me, to collaborate with professionally who has such a deep personal experience about what my patients are going through. But I think more importantly than that, it's really great for the patients that you scan.
Yes. And we're going to talk about that in a little bit. How are you feeling this morning physically? How do you feel these days?
Tired. I have 2 kids. No, I'm feeling really good. Overall, I feel great.
Do you get more tired than your other mom friends because of the heart issues you've had?
I think so. I think that I just kind of know my limits, and I can feel, I kind of have some chest pressure when I'm getting really tired or I'm doing a lot, and I know, okay, this is limiting and I need to slow down a little bit.
Can you explain the specialty care, Dr. Surface, that patients get here who were born with these congenital heart defects and then wind their path takes them to you?
Sure. So, over the past several decades, we've sort of realized that adult congenital heart disease is really its own specialty. There used to be this thought process that congenital heart disease was really the province of pediatrics and pediatric cardiologists. And for a long time, that's the way it was. And in some areas of healthcare, that's still the way it is. But we've recognized that as patients with congenital heart disease grow into adulthood, they develop, unique needs and unique medical considerations that are different from pediatric patients, but they're also different from adult patients with other forms of heart disease. And so that requires a unique specialty. And so now the adult congenital heart disease is an official specialty that's recognized by the American Board of Internal Medicine and the American Board of Pediatrics. And we have built a program here at KU where we can take comprehensive care of folks like Elena and lots of other patients like her who need, that extra added bit of expertise where we can offer just about anything that they might need.
Tetralogy of Fallot is so complicated sounding to someone who doesn't have a medical background, and it's complicated even for people within the health system. Can you explain, looking at the images we're about to put up, what we're looking at here? We know on the left is a normal heart. On the right is a heart with Tetralogy of Fallot. So where are the 4 defects, and how would you explain it to someone without a medical background?
Sure. So again, if you look on the left is a normal heart, and in the normal heart there are 4 chambers. There's atria up at the top and ventricles, which are the pumps of the heart down below, and 4 valves, which are just flaps of tissue that open and close to make sure that blood doesn't go backwards. Tetralogy of Fallot was, it was discovered by this guy named Fallot, and he noticed 4 things in a number of different heart specimens. And one was something called a ventricular septal defect, which is just a hole in the wall between the 2 bottom chambers of the heart.
And where would the hole be if we look at it?
The hole is right here. Okay. Let's see, can I get up from here?
I think you can, or you can do here. Use my thing as a pointer so we don't pull
the hole is right here, and these 2 are the ventricles. And this allows blood to flow back and forth between these 2 ventricles, and it's not supposed to do that.
Oh, okay.
Another is what we call pulmonary stenosis, which just means that there's narrowing here at or often below the pulmonary valve, which makes it hard for blood to get out from the right ventricle and into the lungs. A third is an overriding aorta, which just means that this structure called the aorta, which you can see over here, this red structure here, instead of being completely committed to the left ventricle, it overrides this wall here, the ventricular septum. And then the last is right ventricular hypertrophy, which just means that the muscle of the right ventricle is thick, which is not a surprise. The right ventricle is having to work hard to pump blood through this narrowing, and like any muscle, if it works harder, it gets thicker. And so really, you can think of Tetralogy of Fallot as 4 things, and that's the way it was first described. But fundamentally, there's really 2 problems that need to be fixed. One is a hole, you got to get rid of the hole, and 2 is this narrowing. and you got to treat that obstruction so blood can get out to the lungs.
And then, thank you for such a good explanation. That was very easy to understand for someone with I'm an English major, so medical is like a foreign language, as it is to a lot of people, so that was a great way to explain it. Pentalogy of Fallot. Did this guy Fallot discover that too? And let's explain what pentalogy of Fallot is.
You know, so I don't know if Fallot discovered that as well. What pentalogy of the Fallot is when...
There we go.
Oh, there you go.
There we go.
In addition to the normal 4 things of Tetralogy of Fallot, you also have an atrial septal defect. So that's that more superior hole that you see up sort of at, 10 o'clock on that image where it says ASD.
Okay.
And that's an additional hole that needs to be closed. And believe it or not, that's actually pretty common. Obviously, not all patients with Tetralogy of Fallot are born with this, but atrial septal defects are one of the most common forms of congenital heart disease that we see, and we do see it go with several other things, including Tetralogy of Fallot.
So it's possible to have one, it's possible to have all 4. Elena had 5.
Yeah.
So this little baby was born with all those things happening. How rare is it to have all 5 defects in the heart?
That's a great question. I live in a world of rare diseases, so to me it's common, but to the general population it's not. Tetralogy of Fallot is one of the most common forms of what we'll call complex congenital heart disease, and it comes in a lot of forms, and it comes in a wide array of, a wide spectrum of disease. And having an atrial septal defect or pentalogy of Fallot along with it is a relatively common variant, so we do see it.
So when Elena, when she was in utero, before she was born, was all that stress being placed on her in utero, or does that all manifest once she's born?
That's a great question, and the answer is there's not a lot of stress on the baby in utero. And in part that's just because the way that blood travels through the heart and the body in utero is very, very different than once you are born. If you think about it, when you're in the uterus, there's no air to breathe. And so you really don't need to get blood flow to the lungs. All the oxygen's coming from the placenta. When you're born, you take a big deep breath, the oxygen changes the pressure in the lungs, and all of a sudden a very dramatic conformational change happens on the heart, and it's then typically that the problems really start for most babies.
And one of those problems that sounds terrifying, and parents of babies with Tetralogy of Fallot say it is so scary, is when a baby or their child has a TET spell. What happens? You're nodding your head yes, Elena. What happens during a TET spell?
I think Dr. Surface should probably answer that.
Okay.
Do you remember having them?
Yes.
Yeah. Okay.
You remember having them?
Can you just tell me what it was like?
You just didn't feel good, and I needed oxygen.
Yeah.
And so I would squat down and tighten every muscle I could to try and get that. Just after 1.
So you remember being like a little toddler and
Yeah.
not being able to get enough.
Yeah.
Yeah.
It just didn't feel, it wasn't my normal.
Right.
So I needed help, and that was the only thing I knew how to do.
And what's the telltale sign of a TET spell?
So a TET spell, so you may remember there's a hole, that ventricular septal defect, and there's a narrowing where blood tries to get out to the lungs. Well, if for whatever reason blood is having an especially hard time getting out to the lungs, well, it's got this hole it could go through instead. And so you wind up with more blood flow going through the hole instead of out to the lungs. And that blood that's going from the right side to the left side has very low oxygen content. And so what will happen is babies, the oxygen in their blood will decrease abruptly, and they can actually turn a little bluish in color. And it's very common. What you described, Elaine, is very common. It's sort of the classic description. Kids would crouch down, and what they're doing there is they're really trying to increase the resistance on the left side to force blood to go back left to right.
That's so interesting that your body knows to tell you to do that as a 1-year-old. Because I wouldn't, if I couldn't breathe, I wouldn't naturally think must crouch down and direct blood to different directions. So your body just knew somehow.
It just knew.
Wow. You underwent multiple surgeries as a baby, and you have such a deep understanding medically of what was happening with you. And I saw when we were showing those pictures of you as little Elena in the hospital, your eyes kind of welled up. We should never see patients this small, right?
Yeah, it's tough.
And Can you explain, Elena, where and how the defects were repaired? Because I want to hear your expertise on this. You have a good understanding of it.
So from what I understand is during the surgery, they kind of did what Dr. Surface was talking about. They fixed the hole, made sure that the aorta was predominantly on the left side, and they fixed the narrowing in the pulmonic valve as well. So they opened that up so that it was easy to move blood to the lungs.
When we have a picture of you with as little Elena with your arms above your head, what was that picture?
An x-ray.
Okay.
I had to hold still, and little kids don't like to do that, so it kind of helped me hold still so they could get an x-ray.
Do you have memories of being in hospitals when you were that little?
A little. They're very vague. I mostly, I guess it's my body remembers trauma, because I'll walk into a room or something happens in the hospital and I kind of react. It's like, ooh, I remember this and it wasn't great, but I don't have a great memory of it.
And yet you chose a career working in a hospital.
I did.
Giving a lot of comfort to patients.
That's what I would like to do, yes.
Yeah.
It's better to connect with patients. You know, I've also had heart surgery. I've felt really bad, and my normal is not the normal person's normal, and I understand that. When you're having a bad day, I get it. You just have them sometimes, and you could be doing nothing the day before and
nothing to deserve it. You didn't do anything to bring it on. It just happens.
It just happens.
There was also another problem, as we talked about. You really have had your fair share and more of physical problems, which was that extra membrane of skin that you were talking about that required plastic surgery when you were 18 or 19 months old. Where was that extra membrane or web of skin?
So that I don't 100% know, but I believe it was along the neck here, and it was called a web, and they took that off to try and create a chin and a more normal neck shape.
So it was a web that kind of ran from your
chin
area
all the way
to your
down,
sternum?
Down to I think the clavicle area.
What does that area feel like now?
It feels tight. It's very tight in here.
Do you have to do any exercises?
I do stretches with it.
Okay.
Yes.
And how often do you have to do those?
I do it daily.
Does that affect any of how you chew or swallow or anything like
my
that?
trachea is squashed, so it's supposed to be more round, and mine's kind of crushed like a U almost.
Okay.
And so it's very hard to intubate me, and if I take too big of a bite.
Have you needed to be?
Stuck.
Oh, go on. Sorry. If you take too big of a bite?
It gets stuck sometimes, so you just have to be careful.
Have you needed to be intubated as an adult?
Yes.
Oh gosh. So doctors know going in.
I make sure everybody knows going in.
Right. Now, Dr. Surface, is the webbing or the extra skin here, would that be related to her heart defect?
It can be. Believe it or not, a lot of the same embryologic things that give rise to the heart structures as you develop in utero are also responsible for the developing of a lot of head and neck structures. And so it's actually quite common to see head and neck problems of all sorts of kinds, not specific necessarily to the webbing, but head and neck problems and heart problems go together. So it's a very common combination and can be related to certain underlying genetic defects, but not always.
I want to get to the good stuff that'll make everybody smile, because Elena, you now have 2 beautiful children of your own, and you were told it wasn't possible to carry a child, give birth to a child. You had 2. Why did the other doctors before you came here originally think you couldn't or shouldn't have children?
I think they just didn't know. They just started to commonly do anesthesia with babies in the 80s, and I was born at the end of the 80s.
Okay.
And they just didn't know, I think, how well the repairs would hold up and how it would hold up with the complexities and extra things with pregnancy.
How did they hold up?
For me, great. I had 2 fairly easy, uncomplicated pregnancies, and I had 2 really great births, and I have 2 really cute kids.
What are their names?
I have Embry, she's going to be 4 in July, and Talon, he will be 2 in September.
That's so sweet. And you have such a beautiful family. You sent us so many pictures of you and your husband and your kids. Are the heart problems that you have genetic? Did you have to do genetic testing?
So my parents got genetic testing done, and they said that it was not passed down, that it was just a fluke that I got it. But okay. I can pass it down. And my husband and I both got genetic testing. We went to a genetic counselor. We met with the cardiologist. We met with high-risk maternal fetal medicine, and we made sure we got all the boxes checked before we started to have children.
And all those are available here?
Absolutely, yes, I did it all here.
We have a cardiologist that's cardio-obstetrics doctor, Dr. Roldan. We have a genetic testing, cardiogenetic testing. Now, I know when Elena first came here, you've been here longer than Dr. Surface as a patient and now working here, because when you first came here, you saw a doctor that has since retired. What was it that the team here saw, or what would it be that you would see now, Dr. Surface, that would give you the green light to say, you know what, this patient can have babies, she can start a family?
Yeah, so that's a fabulous question. I think is a really good, it highlights what I was talking about earlier, about how adults with congenital heart disease have unique needs that are different than those of children, because adults want to start families and they have careers, and then can later on in life develop health problems that are, you know, unrelated to their congenital heart disease. And we have now determined we have developed rather a program called the Cardio-Obstetrics Program. And it's one of my favorite things to be a part of. And I know Elena enjoys it too. So you scan our patients when we see them in the Cardio-Obstetrics Program. What we've discovered, honestly, is that most women with congenital heart disease can safely undergo pregnancy, but not all.
Right.
And it takes some careful planning. And so it's always better to do it in a very planned, coordinated fashion where everybody is maximally informed. And we can try and anticipate, hey, what are the possible issues we might run into during pregnancy, and how are we going to surveil for those and look for those and prepare for those, and if we run into them, how are we going to treat them quickly and safely?
We already have some great questions coming in. So if you have a question or a comment that you'd like us to read on air, feel free to send them to us. We will read them aloud, and you can reach us on YouTube, Facebook, the All Things Heart email. You can connect with us right now in real time with those links on your screen. Elena, you are such a sign of hope to others who come here with complex medical issues. How often do you tell the patients that you are working with that you've been down this road and that you are a patient as well?
I tell them pretty often. I think, one, it helps us connect, and it helps break the ice. And our patients sometimes are really nervous when they're coming because they've been feeling bad and they might have to have an intervention done, or, you know, like I said, your body remembers trauma. And so they come and they're like, oh, you know, the last time I had this done, I did have to have surgery. And that is scary for patients. So it's nice that we can connect on that, and I can tell them, you know, what I've done. And a lot of times people like to talk. So it's so nice to say, what is your experience? Can you give me some advice? And it's great to be able to chat with the patients about that.
You've talked about how your mom and dad were so good about making sure you knew you could do anything. What did they tell you about your heart as you were growing up?
Well, kid appropriate. As I grew, they told me everything. I had a heart problem, and when I was tired, I needed to stop. I needed to listen to my body, but I could do whatever I wanted, and I could be whoever I wanted, and they made sure that I knew I was very loved and that I could do it, and they were right. I did.
Such good modeling for you now as a parent.
Yes.
Kids notice everything. Little kids notice everything. Do they ever ask you about scars or what you've been through, and how do you answer those questions?
My oldest is getting more curious about it, and she was actually last night playing with my scar. And she said, what is that? And so I told her, you know, Mommy has a heart problem, but I'm doing really good, and I just had to have surgery. So that's the scar that I have from it. And she looks at me and she says, Mommy, it's beautiful.
Oh, how'd that make you feel?
Wonderful.
Yeah, that's so sweet. What a sweet little kiddo. We've got tissues ready for you. You're going to make me cry now. Dr. Surface, more pediatric cardiology patients you've talked about are now graduating to your clinic. Is your adult congenital heart disease program growing when it comes to patients? And what do you attribute that to? Absolutely,
yeah. Our program continues to grow day over day, month over month, because kids grow up, you know, and our pediatric colleagues have gotten so good at taking care of kids with congenital heart disease that the vast majority of kids born with what used to be uniformly fatal diseases are now growing up healthy you know, into adulthood, and they need someone to take care of them. And so, you know, we've also recognized that it's real common for these kids to get lost to follow-up and to not follow up, and in part that's because historically they haven't always had someone to go to. They haven't had an adult cardiologist to go to who is familiar with their disorders. But we've realized that when folks do get lost to follow-up and when they are not in close follow-up with a congenital heart disease provider, they do worse. You know, bad stuff tends to happen because no one's watching over them. And so we've taken a lot of steps to try and just let the community know about our program and the services that we offer to try and get as many patients into care as possible. And the program's growing like crazy.
And there are parents watching this. There might even be adults watching this who aged out of going to their pediatrician and they're not seeing a cardiologist now for follow-up as grown-ups. We have some questions coming in from viewers, so I want to get to those. Jeremy Yenser has a question. He writes, are there other conditions or things that are more likely that Elena will have to watch out for throughout her life because of this? And by the way, your kids are so adorable. They are adorable.
Thank you. From my understanding, the pulmonic valve may need to be replaced at some point. What else?
Yeah. So you just hit it. With Tetralogy of Fallot, the most common issue that we deal with is issues with the pulmonary valve. Yeah. That valve never really behaves itself completely after surgery, and so it needs to be carefully monitored, and deciding when is the right time to replace that valve is something that you know, can take a lot of hemming and hawing in the clinic as we figure things out. And some people may need many replacements over the course of their lives, and we have worked to try and do more and more and more of that in the cath lab rather than in the OR to minimize the number of open heart surgeries that patients need.
The cath lab would be an alternative to an actual surgery where they go in through your leg.
That's right. Yeah. You got it. Sorry. Yeah. So we can actually now replace valves through the arteries and veins in the groin and sometimes the neck. Yeah. It works very well in carefully selected patients, but you really need a comprehensive center to give you a very thorough evaluation. But there are other issues, of course, that folks at Tetralogy of Fallot can wind up with, and one of them is heart rhythm problems. So we're always very mindful about trying to predict the risk of significant heart rhythm issues and decide, do we need medications, do we need a device like a pacemaker or an ICD? So there's lots of things to look out for over the years.
Eric has a question, again, for Dr. Surface. He writes, when is this usually diagnosed? Is it diagnosed before delivery or after delivery, typically?
So that is evolving. It used to be that it was all after delivery. Pretty much you just sort of had a baby, and if it was blue, you better try and figure out what was going on. Nowadays, we've gotten a lot smarter about that. And as our ultrasounds of babies have gotten better, we're able to diagnose more and more and more congenital heart disease in utero, which is so critical because, one, it makes sure that babies with complex congenital heart disease don't leave the hospital without knowing about it. Right. So that's step one. But two, if you're a mom and you have a baby with complex congenital heart disease, you want that baby to be born in a spot where they can get the care that they need right away if they need it. And we're able to plan for that nowadays. And certainly in the cardio-obstetrics world, when I'm seeing patients who are pregnant or gonna get pregnant, if my patient has congenital heart disease, I recommend that all of those patients get something called a fetal echo, which is just an ultrasound of the baby's heart while it's in utero, to help us rule out congenital heart disease.
Elena, do you know if you were diagnosed in utero or when you were born?
After I was born.
So after you were born is when your parents got that crash course.
Yeah, I was born and they said, it's a girl. And then they said, we don't know what's wrong.
Oh, no.
So first child, and they, whisked me away to try and help me, and I'm sure that would have been incredibly overwhelming for any parent. But I know my parents had a really hard time with it.
Yeah, and you said they were farmers.
Yeah, they're farmers, so they weren't in the medical field at all. But now they're really good at medical things.
they got a crash course.
They sure did.
A mini MD, so to speak.
Exactly.
As we wrap up this conversation, I would love some final thoughts from both of you for our audience. Elena, what do you want people watching to know?
Well, I want everybody to know, no matter what you were born with or what is happening in your life. You can do whatever you want, and there are lots of resources out there, and we can help you. There are people to help you, so reach out.
And you're a great resource to so many patients.
Yeah.
Dr. Surface, what would you like our viewers to know?
I would just echo what Elena said, that, I don't have congenital heart disease that I know of, but I take care of patients with congenital heart disease, and our goal is not just to help patients survive, but to help them thrive in the way that Elena so clearly has. And so I hope that I know that she is an excellent example of what folks with even very complicated disease can do and can accomplish.
Thank you for taking the time to join our program, Dr. Surface. Elena, thank you as well. I know both of you had to leave, had to take a little break from your busy days, and you're going to go right back to seeing patients, so thank you so much. Elena, thank you for sharing your journey and all those pictures. You will help so many families who hear your story and see your journey.
Thank you.
And thank you for joining the conversation this morning. If you'd like to watch or share any one of our previous episodes, scan the QR code on the screen right now. This will take you to links of all of our previous episodes. Next fall marks season 8 of All Things Heart. Season 8. That means over the summer, we will be working hard on new episodes, bringing you incredible patients with fascinating new stories. Over the summer, we will be working on those, and we will be airing encore presentations of our favorite episodes. But we will still be here at the health system in the newsroom. If there's any big breaking news health-wise, we'll bring it to you live. And we will be back here on September 4th for season 8 of All Things Heart. Have a great day.
Coming up tomorrow on the Morning Medical Update, the most dedicated athletes don't have an off season. So how do they fight the summer slump and stay in form? I'm Jessica Lovell on the next Morning Medical Update. See sports-specific drills for young athletes trying to keep their edge, and meet the expert trainers pushing kids, teens, and college athletes to be better. Friday at 8.